Good morning, good afternoon, and good evening. After increasing for nearly 2 months, the global number of COVID-19 cases and deaths was stable last week. But it's stable at a very high level, more than 4.5 million cases and 68,000 deaths. However, the situation is very different from region to region, country to country, province to province, and town to town. Some regions and countries continue to see steep increases in cases and deaths, while others are declining. As long as this virus is circulating anywhere, it's a threat everywhere. There are no shortcuts. WHO continues to recommend a comprehensive, risk-based approach of proven public health and social measures in combination with equitable vaccination.
Israel's nationwide vaccination campaign was hailed as a success story that helped to drastically reduce infections in the country. But the latest Delta variant outbreak has led to an increase in cases, and many experts believe that the crisis is far from over. Israel was one of the first countries to vaccinate a majority of its population in a very small amount of time. By June, the mandatory mask requirement was completely dropped, and the only COVID curbs that remained were regarding international travel. Now, the rate of infection has again risen to 5.4%, and the Bennett government has said that it will take necessary measures to avoid further lockdowns. As Israel's COVID wave continues to worsen, the country's top COVID official admits that authorities mishandled the crisis with regard to inoculating the unvaccinated. During an interview, Israel's coronavirus czar, Professor Salman Zarqa, said that COVID-19 is here and it will stay, and we may have to wear a mask for many months. While acknowledging the government's mistake, Zarqa said that officials were pressurized to formulate policies without sufficient data. Israel has one of the highest vaccination rates in the world, with 78% of the adult population fully vaccinated. Despite this, the country is currently witnessing a significant spike in cases. Our correspondent Jody Cohen has sent us more details in this next report from Jerusalem. Listen in.
Israel was an early success story in the COVID pandemic, effectively becoming the testing laboratory for Pfizer's vaccine and sharing its medical data with the world. However, coronavirus czar Professor Salman Zarqa now says Israel dropped the ball and should have done more to encourage further vaccination while COVID cases were low. Suggesting Israel won the battle but the war is still here, he said preparations are needed for a possible fifth wave. With kids going back to school next week and the Jewish New Year festivities approaching, the government is busy looking at what more it can do to limit the spread of the Delta variant. This is Jody Cohen from Renana, Israel for WION World is One.
WION World is One is now available in your country. Download the app now and get all the news updates on the move.
Good evening. The reality of our battle with COVID hit home today as the state recorded the worst case numbers of the pandemic so far, 1,035 new infections. It's placing immense pressure on our ambulance system and pushing our paramedics to their limits.
Ali Naiman, 70 years old, died from COVID at 4:30 this morning. Left behind 14 children and 53 grandchildren. Ali from Yaguna didn't know how he got the virus, and he had had one shot of a vaccine. His devastated daughter Amy now has a message: take COVID seriously, stay home and get vaccinated. In Milson's Point this morning, tributes for Jimmy. Jim Sard was a fixture of the train station, working as a cobbler and key cutter for nearly 60 years, another casualty of the state's COVID crisis.
To have any loved one pass away at any time is obviously challenging, but in this COVID situation, I think many of us are feeling it even more.
1,035 new COVID cases in the past 24 hours, another all-time high. And to 8 p.m, 2 more people who've lost their lives. A woman in her 70s died at Nepean Hospital where she caught the virus. A woman in her 80s from Western Sydney has also died. In a war with a virus, our paramedics are the firing line.
Our workforce is going from job to job to job without a break. They are virtually wrapped in plastic. They are doing their job without expecting anything in return.
Just yesterday, called to help 450 patients with COVID or suspected COVID.
Over the last 3 days, New South Wales Ambulance has experienced call demand to 000, equivalent of our busiest New Year's Eve.
But officials found low confidence it was an animal infection that started COVID and a moderate confidence that it was a lab incident. I assume you've read this report. If that's the case, should China be held more responsible for this? And how do we move forward?
Well, let me tell you what I think, and then I'll tell you what I know. What I think is that the report was pretty unsatisfying because the intelligence community, even though the president asked them to, was really not able to come up with a definitive answer as to whether or not this was natural transmission from animal to human or whether there was a lab leak. Now, this is something that I've been reading about for a very long time in classified environments, and the intelligence community is a little bit at odds with itself on that. Now, why is that? And here's where you absolutely do hold the Chinese accountable. The reason for that is that the Chinese, from moment one, 18 months ago, have not been open and honest with the world or with the United States with the data and the information that we would need to form some kind of a judgment.
Well, I appreciate all of your insights. Connecticut Democratic Congressman Jim Hines, thanks for your time tonight.
Thank you.
Tonight, with an expected major hurricane taking aim, Louisiana hospitals already dealing with a surge of COVID-19 patients are now preparing to shelter in place. Dr. Jeffrey Elder telling me this is a worst-case scenario.
This is a large hurricane. We have to be ready for that. We know we're going to have higher census because of the COVID patients in the hospital, and so we're preparing for both simultaneously.
Louisiana has one of the highest COVID-19 case rates per capita in the country. The storm already forcing some testing and vaccine sites to shut down early. As residents race to prepare and evacuations begin, Ida is forecast to make landfall 16 years to the day since Hurricane Katrina in 2005. Okay, we met Dr. Tanner Libsack, still in his scrubs from treating COVID patients, now preparing to board up his home.
Jumping right into this is just kind of a bit of a mess, but we're doing the best we can.
And Victor Akenda joins us now. Victor, Hurricane Katrina devastated the city, as we all know, 16 years ago, and hospitals had a lot of major difficulties at the time. How are they preparing now, differently perhaps?
Juju, one of the doctors that we spoke with explained how hospitals here have been hardened since Hurricane Katrina to bear the brunt of a storm. They've fixed issues like water, sewage, electricity, and he explained how in the event where they have to be cut off from the rest of the world for some time, they're ready. Juju?
Tonight, the toll of the pandemic growing by the day. More than 1,200 deaths reported in just 24 hours, the highest single-day total since early March.
It's tough for the ones who have been through it already to see these people struggle and die.
In just the last month, the virus spreading like wildfire. All 50 states now reporting high community transmission. In Oregon, hospitalizations up nearly tenfold in the last 6 weeks.
With fewer staff and fewer beds, we're struggling to meet patients' needs.
Hospitalizations in Kentucky breaking records. The governor frustrated.
I'm going to admit up front today, a little emotional and a little raw.
But in Florida tonight, a major legal victory for 10 school districts defying Governor Ron DeSantis' ban on mask mandates. A judge ruling the governor overstepped his authority, DeSantis vowing to appeal. This as the country reaches a new milestone. 50% of kids 12 to 17 years old have now had their first vaccine dose. And overall, more than 1 million doses administered in the last day, the most in 8 weeks. In Central Florida, Lisa Stedman now wants the shot. She and her husband were holding off when they both got COVID. Lisa coming home from the hospital this week, only to find her husband had passed away from COVID-related complications.
And remember, you are not promised tomorrow, so you better make sure you tell your loved ones you love them.
And Witt joins us now with the Director of National Intelligence today releasing that unclassified assessment on the origins of COVID-19. Tell us about it.
Juju, this report indicates that the intelligence community is divided over the findings. 4 agencies assessing with low confidence that the COVID-19 virus spread to humans naturally from an infected animal. Another agency assessing with moderate confidence that it came from a lab leak or lab incident of some kind. However, there is more agreement that the virus was not created as a biological weapon. Still, more information is needed from China. And tonight, President Biden is promising that efforts to understand the origins of this pandemic will not rest.